Your body is talking to you every single day. Long before a disease reveals itself on a scan, your body is already sending signals. Quiet ones, subtle ones, the kind we're taught to brush aside. Oh, it's just stress. Maybe I ate something wrong. I'm just getting older. But here's what decades of studying disease has taught me. The body doesn't waste signals. It doesn't cry wolf. When something changes, an ache that lingers, a shift in appetite, skin that looks a little different in the mirror, that's not noise, that's information. And when it comes to one of the most silent and serious diseases we know, pancreatic cancer, those early signals matter more than almost anywhere else in medicine. This is a cancer that has earned a reputation for hiding in plain sight, often mistaken for indigestion, back pain, or simply, quote-unquote, getting older. For seniors especially, that mistaken identity can cost precious time. And time, when it comes to pancreatic cancer, is everything. So today, I want to do something simple, but potentially life-saving. I want to teach you how to listen, really listen, to 8 specific signals your body may already be sending. Because awareness isn't just knowledge. Awareness is power. And in this case, it might just be the thing that saves a life, maybe even yours, or someone you love. Let's begin. Let's start with something that sounds almost too simple to matter: weight loss. We live in a culture obsessed with losing weight, so when the pounds start coming off without effort, without a new diet, without extra hours at the gym, most people quietly celebrate. They tell themselves they're finally getting healthier. But your body doesn't lose weight for no reason. Every system you have is designed to hold on to energy, to protect itself, to store fuel for the future. So when it starts shedding weight rapidly, 5, 10, 15 pounds in a matter of weeks, without any change in behavior, that's not a gift. That's a warning. With pancreatic cancer, this happens for a very specific reason. The pancreas isn't just about blood sugar. It's a factory for the enzymes that break down fat, protein, and carbohydrates so your body can actually use them. When a tumor disrupts that factory, digestion falters. Nutrients pass through the body without ever being absorbed. At the same time, cancer cells are remarkably efficient parasites. They hijack the body's metabolism, demanding energy for their own growth, often at the expense of muscle and fat elsewhere. For seniors, this symptom is especially easy to dismiss. Weight naturally shifts with age. Appetite naturally changes. Clothes fit differently for a dozen innocent reasons. But there's a difference between the slow, gradual changes of aging and the sudden, unexplained kind. The kind where nothing in your routine has changed, yet the scale keeps dropping. That distinction between gradual and sudden, between explained and unexplained, is often the very first clue that something deeper is happening inside the body, long before any other symptom makes itself known. Now let's talk about pain, specifically pain in the abdomen or the back. This one is tricky because pain is something we've all learned to live with, especially as we get older. A sore back after gardening, an ache after a long car ride. We reach for a heating pad, take some ibuprofen, and move on with our lives. And most of the time, that instinct is correct. But there's a particular kind of pain associated with pancreatic cancer that behaves differently, and learning to recognize that difference can matter enormously. The pancreas sits deep in the abdomen, tucked behind the stomach, wrapped closely against major nerves and structures along the back of the body. When a tumor grows there, it doesn't just sit quietly. It can press against those nerves, invade surrounding tissue, and irritate the sensitive network that runs along the spine. That's why the pain often isn't confined to the stomach alone. It radiates. It reaches around to the middle or upper back in a way that a pulled muscle simply doesn't. There's another clue hidden in the pattern of this pain. Many people notice it worsens after eating and eases somewhat when they lean forward or curl into a certain position. That's not typical of ordinary back strain. It's the body responding to pressure and inflammation deep inside, not from muscles or joints. And perhaps most telling of all is persistence. Muscle aches fade in days. This pain lingers, quietly, stubbornly, for weeks, resistant to rest, to stretching, to the usual remedies that normally bring relief. For seniors already managing arthritis or chronic back issues, that persistence can easily blend into the background of everyday discomfort. But pain that changes character, that spreads in unfamiliar directions, that refuses to respond to anything you try, that's the body drawing a very particular kind of map, one worth paying attention to. Let's talk about jaundice, that unmistakable yellowing of the skin and the eyes. Of all 8 signals, this is often the one that finally gets people through the doctor's door, because unlike fatigue or stomachache, you can actually see it. You look in the mirror and something has visibly changed. The whites of your eyes take on a yellow tint. Your skin takes on a sallow, almost golden hue. And often people notice something else alongside it. Their urine turns unusually dark, almost like tea, while their stool becomes pale, almost clay-colored. Here's why this happens. The pancreas sits right next to the bile duct, the narrow channel that carries bile from the liver and gallbladder down into the intestine, where it helps digest fat. When a tumor forms in the head of the pancreas, which is actually the most common location, it can press against that duct and block it. Bile backs up. It has nowhere to go but into the bloodstream, and from there, it deposits itself into the skin and the eyes, turning them yellow. That same blockage explains the color changes in urine and stool. Bile that should be flowing into the digestive system is instead being rerouted, and the digestive system fails to get the pigment it normally would. What makes the signal so significant is timing. Jaundice from a pancreatic tumor often shows up earlier than people expect, particularly when the tumor is located in the head of the pancreas near that bile duct. That means in some cases, it can actually be one of the earlier warning signs rather than a late stage one. And because it's visible, something you or someone who loves you can actually notice by simply looking at your face, it becomes one of the most important reasons never to dismiss a subtle change in color as merely looking tired or run down. Now let's talk about appetite, or more specifically, the sudden disappearance of it. For most of us, food is one of life's steady pleasures. The smell of coffee in the morning, the anticipation of a favorite meal, hunger arriving right on schedule like clockwork. So when that hunger simply stops showing up, when food that once sounded appealing now feels like a chore, or worse, something you'd rather avoid altogether, that shift deserves attention. With pancreatic cancer, this loss of appetite often isn't just psychological, it's biological. Tumors release certain signaling molecules that interfere directly with the body's hunger regulation, essentially telling the brain that the body is full even when it isn't. At the same time, if the tumor is affecting digestion, which, as we discussed, it very often does, eating can start to feel physically uncomfortable. Bloating, nausea, or a heavy, sluggish feeling after even small meals can make the whole experience of eating something to dread rather than enjoy. For seniors, this symptom carries a particular kind of danger because appetite changes are so often written off as normal aging. Taste buds dull with age, certain medications suppress hunger, loneliness, especially for those eating alone, can dampen interest in meals. All of these are real and valid explanations, most of the time. But when appetite loss is new, persistent, and paired with any of the other changes we're discussing today, unexplained weight loss, pain, changes in skin color, it stops being an ordinary part of aging and starts being a pattern worth investigating. This is precisely why family members and caregivers play such an important role here. Often, it's not the person experiencing the appetite loss who notices it first. It's the son, the daughter, the spouse across the table, quietly registering that a plate that used to be cleared is now barely touched. Let's talk about something that surprises most people: diabetes. Not diabetes someone has managed for 20 years, but diabetes that shows up suddenly, late in life, seemingly out of nowhere. A person in their 60s or 70s with no family history, no significant weight gain, no obvious risk factors, goes in for a routine checkup and is told their blood sugar is elevated. Most people accept this as simply another consequence of aging. But new-onset diabetes in an older adult is one of the most under-recognized warning signs we have for pancreatic cancer. Here's the connection. The pancreas has 2 very different jobs. Most people know about one of them, producing insulin, the hormone that regulates blood sugar. What fewer people realize is that a tumor growing in the pancreas can directly interfere with the very cells responsible for making that insulin. As the tumor grows, It disrupts insulin production and the body's ability to regulate glucose, and blood sugar begins climbing in ways that look on the surface just like ordinary type 2 diabetes. What makes this signal so important is the pattern researchers have identified: diabetes that appears abruptly without the usual risk factors like obesity or a family history, particularly in someone over 50, sometimes precedes a pancreatic cancer diagnosis by months, occasionally longer. It isn't the diabetes itself causing the cancer, it's the tumor quietly announcing its presence through the one system it happens to control. This is why context matters so much in medicine. Diabetes is common. It affects millions of people, and the overwhelming majority will never develop pancreatic cancer. But new diabetes, appearing suddenly and without explanation in an older adult, especially alongside any of the other signals we're discussing, is a pattern worth bringing to a doctor's attention rather than simply accepting as one more prescription to add to the list. Now let's talk about digestion, the nausea, the bloating, the changes in your stool that so many people quietly endure and just as quietly ignore. We've all had an upset stomach. We've all blamed a meal, a bit of stress, something that just didn't agree with us. Digestive discomfort is so common, so universal, that it's often the very last thing we think to worry about. And that's exactly what makes it such a useful disguise for something more serious. Remember, the pancreas produces the enzymes responsible for breaking down fat, protein, and carbohydrates. When a tumor interferes with that enzyme production or physically blocks the ducts that carry those enzymes into the intestine, digestion doesn't just slow down, it changes character in specific ways. Nausea becomes more frequent, sometimes worsening after meals. Bloating sets in, a persistent fullness that doesn't seem tied to how much was actually eaten. And perhaps most tellingly, stool itself can change, becoming pale, oily, or unusually foul-smelling, floating rather than sinking, a sign that fat is passing through the body completely undigested. For seniors, these symptoms are especially easy to attribute elsewhere. Digestive changes happen naturally with age. Certain medications cause exactly these side effects. A sensitive stomach might simply run in the family. Any one of these digestive complaints taken alone means very little. But taken together, nausea that lingers, bloating that doesn't resolve, and stool that has visibly changed in color or texture, especially appearing greasy or floating, that combination starts to paint a different picture. It's rarely a single digestive symptom that tells the story. It's the cluster, the combination, the way multiple small changes arrive together and refuse to go away, that turns ordinary digestive complaints into something worth a deeper conversation with a doctor. Let's talk about fatigue, perhaps the most universal complaint in all of medicine, and precisely because of that, one of the easiest to overlook. Everyone is tired. Seniors especially hear this dismissal constantly, from doctors, from family, even from themselves. Of course you're tired. You're not as young as you used to be. But there's a profound difference between ordinary tiredness and the kind of fatigue that accompanies serious illness, and learning to tell them apart can make all the difference. Ordinary fatigue responds to rest. You sleep well, you take it easy for a day, and you feel restored. The fatigue associated with pancreatic cancer behaves very differently. It's deep. It's persistent. It doesn't lift no matter how much sleep you get or how many days you spend resting. This is what doctors sometimes call cancer-related fatigue, and it has real biological roots. As we discussed earlier, tumors are metabolically demanding. They consume energy and nutrients that would otherwise fuel the rest of the body. At the same time, the body's immune system, sensing something is wrong, releases inflammatory molecules in response to the tumor's presence, and those same molecules are known to produce a profound, whole-body sense of exhaustion. Add to this the effects of poor digestion and nutrient absorption we've already discussed, and it becomes clear why this fatigue is so much more than simply feeling sleepy. It's a kind of exhaustion that reaches into the muscles, into concentration, into motivation itself, a heaviness that coffee doesn't touch and sleep doesn't solve. For families, this can be one of the hardest signals to catch, precisely because it develops gradually. A parent who once enjoyed gardening or walking now spends afternoons in a chair. It's tempting to call this simply getting older, But when fatigue arrives suddenly, deepens steadily, and refuses to respond to rest, it deserves far more attention than we typically give it. Finally, let's talk about something that surprises almost everyone the first time they hear it: blood clots. Specifically, a deep vein thrombosis, a clot forming in the veins of the leg, or a pulmonary embolism, a clot that travels to the lungs. At first glance, these seem to belong to an entirely different conversation, something related to circulation, to sitting too long on a flight, to a hip replacement recovery. Rarely does anyone connect a blood clot to the pancreas. And yet, this connection is real, well documented, and often one of the earliest, most silent signals this cancer produces. Here's why it happens. Pancreatic tumors have a unique ability to alter the blood's clotting system. They release substances that shift the body's blood chemistry toward a state that favors clot formation, a phenomenon doctors sometimes describe as a hypercoagulable state. This means that even without any of the usual risk factors, a long flight, a recent surgery, prolonged bed rest, a person's blood becomes more prone to forming clots than it should be, simply because a tumor is quietly influencing the chemistry of the bloodstream from somewhere deep inside the abdomen. The warning signs of a clot are worth knowing on their own merit: sudden swelling in one leg, warmth or redness along a vein, unexplained pain in the calf, and if a clot travels to the lungs, the signs escalate quickly: sudden shortness of breath, chest pain, a racing heart. These symptoms demand emergency attention, regardless of their cause. But what makes this signal so important for our conversation today is context. A blood clot appearing without any clear explanation in someone who isn't otherwise at obvious risk is sometimes the body's very first announcement that something deeper is happening, occasionally showing up before any of the other 7 signals we've discussed ever appear. 8 signals: weight that disappears without explanation, pain that spreads into the back and won't let go, skin and eyes that take on a yellow tint, an appetite that quietly vanishes, blood sugar that rises out of nowhere, digestion that changes in ways that are hard to ignore, fatigue that no amount of rest can fix, and blood clots that seem to come from nowhere at all. None of these symptoms on their own means you have pancreatic cancer, but together, or persisting without explanation, they're worth a conversation with your doctor. Not fear, not panic, just attention. Because with this disease, more than almost any other, awareness bought early is time earned back. If this information could help protect you or someone you love, don't keep it to yourself. Share it with them today. And if you found this valuable, hit subscribe, leave a comment below with your thoughts, and stay with me for more conversations that could genuinely save a life.